can still be repeated today so that you can have the appropriate answers to them. Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, let me once again welcome you all to the briefing for Tuesday, 21st of April 2020. We are in the 4th week of the lockdown of Lagos and Ogun states, as well as the Federal Capital Territory. And the Presidential Task Force continues to assess the impact vis-à-vis the objectives. Let me remind us all that the lockdown and the subsequent extension was to slow down the spread of the virus by minimizing contact and congregation of people and to enable us put in place necessary infrastructure, train personnel, take delivery and distribute essential equipment and materials in readiness for any eventuality. I informed you yesterday that pursuant to the objective, the DG of the Nigerian Center for Disease Control and the WHO representative on the Presidential Task Force have been touring the states to assess and standardize their infrastructure and their readiness. They have so far visited 6 states: Imo, Anambra, Rivers, Delta, Katsina, and currently in Kano. 3 more states will be covered by Wednesday tomorrow. While the PTF continues to assess the impact of the lockdown preparatory to submission of a report to Mr. President, we have observed general compliance with the restrictions. However, much more work shall be required in the creation of awareness among the people and in securing a buy-in of all stakeholders. I find it necessary to remind us all that this COVID-19 pandemic is not a joke, and it is a global pandemic. I therefore renew the appeal of the PTF to all Nigerians to view it as such and comply with all advisories and directives in the interest of humanity. The reports coming out of the continuing collaboration with the states indicate the following. 1, governors have been at the head of the response, which is encouraging. And 2, the state emergency operation centers and their treatment centers are in place. 3, there are improved levels of preparedness and response activities, focusing more on strengthening current capacity where they exist over building new structures. And 4, there is obvious need to support the states in strengthening coordination across board. 5, more guidance should be provided in the area of non-pharmaceutical interventions. 6, particular attention is to be focused on some states with heavy burden, particularly now on our radar, Kano. And 7, priority is being placed on intensive state-level support. I'm pleased to inform you that as part of the support to the states, the Presidential Task Force has approved the distribution plans for medical equipment and consumables available in stock to the states. The physical distribution shall commence immediately. This will be in addition to the JACMA equipment and materials already shared to the states. Let me once again thank the media for the tremendous support we continue to receive. I similarly thank the selflessness of our frontline health workers and other workers for their professionalism and hard work. We stand with you as you work to save lives. I equally thank countless public-spirited Nigerians, corporate organizations, faith-based organizations, etc. for demonstrating unparalleled commitment to the survival of our nation and for being our brother's keeper. Before I invite the Honorable Minister of State Health to the podium, I consider it apt to repeat that this is time for all hands to be on deck so that the Presidential Task Force can improve on its delivery. Unity of purpose is critical. Everybody has a role to play for self, for family, for community, for the nation, and for humanity. I now invite the Honorable Minister of State Health to update you on the current developments. Thank you.
Thank you, Mr. Chairman. My colleagues on the PTF team, distinguished ladies and gentlemen, as at today, 21st April 2020, a total of 665 people in 24 states and the Federal Capital Territory have been confirmed to have COVID-19. The 38 new confirmations are distributed as follows: 23 in Kano, 5 in Gombe, 3 in Kaduna, 3 in Borno and Abia, 1 in FCT, Sokoto and Ekiti. We have recorded 22 deaths and 188 people have recovered from COVID-19 and have been discharged from hospitals. The National Rapid Response Team supporting the COVID-19 response in each affected state and 23 rapid response teams have been deployed. With the community transmission, we are doing active case search in communities, and this strategy requires more testing kits and diagnostics. Currently, we are assessing additional laboratories for accreditation and will announce more laboratories soon. We have 13 so far. We have intensified efforts in risk communication at grassroots level. The need to avoid mass gatherings without protecting yourself cannot be overemphasized. The use of face masks or face barrier that covers your mouth and nose has been scientifically proven to reduce spread of respiratory infection. I therefore urge all Nigerians to practice hand and respiratory hygiene, avoid mass gathering, and put on a face mask at all times, particularly when you leave home. The improvised cloth mask will suffice at community level. And in this regard, we advise you do not use nylon material or polyester material. The improvised cloth mask, which I've just referred to, will go a long way to help our people. Please always wash and iron at the end of the day. That is when you use the improvised face mask. I urge all Nigerians to make this sacrifice for all of us and for our loved ones. Together, we shall not only stop the spread of the virus, but we will defeat COVID-19. Let me continue to thank our health workers for the good work they are doing and the sacrifices they are making. Nigerians are grateful and say big thank you to you all. I also want all our health workers to be extra vigilant and ensure they protect themselves as they do their jobs. We shall strive as government to ensure we provide you with all the necessary personal protective equipments required to do your work. For all Nigerians, please call the NCDC number if you suspect you have any of the symptoms or you think your neighbor has the symptoms. Stay home, stay safe, and take precautions. If you must leave the house, practice physical distancing, hand and respiratory hygiene, and put on your face mask. In solidarity, we shall conquer. Thank you very much.
The Secretary to the Government of the Federation, Honorable Ministers, members of the Presidential Task Force, and ladies and gentlemen of the press, good afternoon. Today I will re-echo what the Honorable Minister of State Health has said with regards to face masks. We continue to urge you to use face masks as an optional addition to the routine measures of physical distancing, avoiding mass gatherings, and respiratory hygiene. In line with the NCDC face mask policy, we advise Nigerians to make DIY, do-it-yourself face masks. Not only are they cheaper, but they are also more colorful, as we can see from the chairman's mask. We do recognize the Nigerian creative enterprising spirit already at work, with so many people already making use of local fabrics. We'd like to urge you to continue to adopt all procedures for improvised mask usage and maintenance based on the NCDC guidelines. With regards to state engagement, we continue to engage collaboratively with state governments on the pandemic response. The task force will continue to provide necessary assistance to states to ensure adequate sensitization. In this regard, we would like to acknowledge and thank both the public as well as the private media for the support they have been providing in terms of information and education materials on TV, radio, jingles, etc. With regards to vulnerable groups, we would like to confirm that the PTF response activities do include vulnerable groups, including people with disabilities, the elderly, etc. And we will continue to work with the Ministry of Humanitarian Affairs to ensure palliatives reach them. After all, we are one nation, and we need to ensure that vulnerable members of society are taken care of, especially in these difficult times. We do note the concerns about increased reporting of cases. We are closely monitoring Kano, Osun, Oyo, and Edo. We note the particular concern with Kano, and we have engaged closely with the state government. Because we are increasing the number of tests as we ramp up, there is a possibility that we will continue to have more and more cases coming in. Finally, I would like to re-emphasize the need for complying with the lockdown policy, particularly for those two states of Lagos and Ogun, as well as the FCT. I would like to urge Nigerians to please stay at home. If you do have to come out, please ensure that you respect the physical distancing and avoid mass gatherings, as well as using your face masks, and make sure you're coming out for a good reason. You really wouldn't want to catch coronavirus. Thank you.
Thank you very much. Before we go to the question session, we will take reports in this order. The Honorable Minister of Information and Culture, the Honorable Minister of Environment, and the Honorable Minister of State Education. We begin with the Honorable Minister of Information and Culture.
Mr. Chairman and other members of the PTF COVID-19, distinguished gentlemen, although a respected opinion poll, the NOI polls have shown that 99% of Nigerians are aware of COVID-19, the Federal Ministry of Information and Culture and its agencies have ramped up the public enlightenment and advocacy campaign to continue to reach Nigerians with information on how they can protect themselves and avoid contracting the disease. This is necessary because in the absence of any vaccine or drug, non-pharmaceutical intervention remains the most effective way to contain the spread of disease and protect Nigerians. By the way, you must ignore the vaccine being hawked in Kano, which is called COVID-19 vaccine. It's yellow in color. It is not certified by anybody. Please don't patronize the hawkers. The campaign has therefore continued to focus on the need for the populace to adhere strictly to social distancing and mass gathering restrictions. Wear face masks and ensure group personal hygiene. The ministry has now rolled out a new set of TVCs and radio jingles focused on the MPR intervention. The TVCs and the jingles in English, Pidgin, Hausa, Igbo, and Yoruba have started to play on the NTA and the FRCN. We are in the process of rolling them out on state and private radio and television stations across the country and also on the social media. We have no choice since information remains the most potent tool that can be deployed against the virus today. NTA, FRCN, LAN, and VON are also fully engaged in the public enlightenment and advocacy campaign. These agencies have used their own resources to produce TVCs and jingles, which they have continued to air and disseminate, in addition to devoting a large chunk of their programs and time to the campaign. I'm also glad to announce that, contrary to the belief in certain quarters, the National Orientation Agency, despite lacking adequate resources, has shown creativity in its bid to take the campaign to Nigerians. The agency has leveraged its relationship with NGOs and the private sector to produce information, education, and communication materials which are now being disseminated to Nigerians in English, Pidgin, Fulfulde, and Hausa, Yoruba, and other indigenous Inuit languages. The NT and the FRCN have provided their platforms for the dissemination of these IECs. The advantage here is that some of these materials can also be disseminated to Nigerians through their phones, thus helping to spread them quickly and widely. The next phase of the public enlightenment and advocacy campaign is to develop and disseminate IEC materials on the need to avoid stigmatizing those who have contracted the virus, the need to shun fake news, and the need to reach those who are visually challenged or hearing impaired. We have already started working on this. In the meantime, the National Broadcasting Commission has taken steps to prevent misinformation via the broadcast stations by warning them to adhere strictly to the professional ethics of balance and fairness in reporting COVID-19. In particular, the Commission has warned the stations against bringing on their programs panelists in court with agenda to make reckless statements and insinuations. The Commission, in its warning letter to the broadcast stations, quoted relevant sections of the Broadcasting Code. For example, the NBC quoted Section 541, which says the broadcaster shall at all times ensure that the coverage of a disaster or crisis is aimed at overall public interest, guidance, and safety. It also quoted, among others, Section 411, which says panelists in court in a discussion program must reflect various viewpoints. The Commission has warned that failure to adhere strictly to the provisions of the Broadcasting Code will attract sanctions as stipulated by the Code. Thank you.
Honorable Minister of Environment.
Mr. Chairman, honorable ministers, ladies and gentlemen, members of the press, good afternoon. From the Federal Minister of Environment, what we have been doing and the exercises and activities that were undertaken currently in the containment of the coronavirus. Number one, environmental health surveillance activities which have been undertaken right from the beginning, the purpose of which is advocacy and promotion of hygiene. Our coverage area is the 774 local government, where we have already deployed over 7,000 environmental health officers. What we achieved is that we have gone down to the level and creating awareness. And we believe by so doing, the community volunteers are also joining in and increasing the number of people that are getting in contact with the population to create awareness. We have just finished the training of 100 master trainers. We did this in cluster of 15 in order to maintain the social distance. And this 100 have just commenced training additional 3,000 environmental health emergency response volunteers in all the 774 local government. Our activities in decontamination and disinfection, that also is ongoing. Again, the purpose of which to contain the virus is ongoing in the 774 local government. In our second phase, we are currently disinfecting 150 high-risk areas, again, around the 774 local government. And our personnel also are in all the states and providing technical support to the state government. In our effort with interagency collaboration, we are partnering with the NCAA and FAN, and we have mapped out 125 aircraft and 13 airports across the country for decontamination and disinfection. Also, what might interest you is that the Federal Ministry of Environment, through one of our agencies, the Federal Forestry Research Institute of Nigeria, we are producing hand sanitizers, and these are herbal-based, again for the containment of the virus, and we are distributing this to communities and high-risk areas, security personnel that are in the process of making sure that people comply with the lockdown. So the ministry has been busy with this. I will just quickly say a little in Hausa, because somebody asked that they need to know exactly what is going on. So jama'a assalamu alaikum. Wannan annoba ta corona kamar yadda muka sani ta shigo a ƙarshen waccan shekara kuma ta mamaye duniya. Abu ne kuma da gaske ne, na tabbata masu kallon TV suna gani, ƙasashen duniya mu kaɗai ba, wannan cutar annobar tana kashe mutane a kulliyomin, kuma ba ruwanta da matsayin mutum, ko kai mai kuɗi ne ko talaka, ko mai mulki ko mara mulki, ko sarki ne ko bafade ne ko bawa ne, ba ruwanta da sarauniya ko sadaka ko kuyanga ko kwarkwara, duk wanda ta samu za ta kama. Mun gani a wurare da yawa, dan sarauniyar Ingila ya kamu, shugaban Ingila ya kamu, da sauran mutane, mu ma nan a nan mun gani. Jama'a, wannan abin da gaske ne, kuma ɗaya daga cikin manyan abubuwan da zai dakatar da yaɗuwar wannan cutan shine wannan zama a gida ɗin. Gwamnati ba ta kama mutane ta rufe ba ne kawai don tana so ta rufe, a'a, domin an duba duk duniya abinda kowa yake kenan a samu sauƙin yaɗuwar wannan cuta. Mun ga inda ta faru a ƙasar Sin, ƙasar China kenan. Mun ga abin da yake faruwa a ƙasar Italy da sauransu. Yanzu haka mun ga abin da ke faruwa a ƙasar America. A sanin kowa, America tana ikirarin a duk duniya ba ƙasa da ta kai ta komai. To yau wannan ƙwayan zarrar cutan corona ta tasa America a gaba. Yanzu America tana karɓan, tana neman taimako a ko'ina da ƙasashen da suka kaita da ba su kaita ba. Jama'a, don Allah mu zauna a gida a duk sa'ilin da aka ce mu zauna a gida ya fi a'ala. Sannan kuma mu kula da sauran ƙa'idoji da ake gindayawa na wanke hannuwa akai-akai, rashin taɓa fuskanka, kuma wannan takunkumi da ake sawa yana taimako ga wanda bai da shi ya kare shi, ga mai cutar ya rage yaɗawa. Za ka iya ɗinka naka ka sa, kamar yadda muka gani a waɗansu a cikinmu nan sun ɗinka sun sa. Abin da ake bukata shine ka kare kanka, ka kare wasu. To saboda haka a yi ƙoƙari a bi dokoki. Sannan akwai mu'amala, tazarar mu'amala da ake cewa social distance da turanci, na a tsaya nesa da juna idan wani abu ya haɗa aƙalla taku 3 zuwa 5 tsakaninka da sauran mutane. Kuma abin da aka hana na taro na mutane da yawa, don Allah a bari. Wannan abu ne wanda zai zo ya wuce in Allah ya so ya yarda, amma fa sai mun bi doka, mun bi tsari kafin mu samu nasara. Allah ya ba mu ikon ganin wannan abin har lokacin da zai zo ya wuce. Mun gode.
Thank you. Honorable Minister of State Education.
Good afternoon. Thank you, Mr. Chairman. Quickly, I would like to give a few overview of what we are doing at the Ministry of Education in relation to how we perceive students should be working at this time. As you are aware, we've announced that WAEC and NECO for the year has been postponed. This postponement is indefinite at the moment, and until as soon as we arrive at a definite time, we will re-communicate that. We will also be looking at what we will do in order for schools to reopen. As you recall,